COVID-19 in Nigeria, and that's really alarming. Today, let's turn the searchlight onto Lassa Fever and see what's happening there. How many infections do we have? Are people recovering? What's it just like around Lassa Fever in Nigeria? Now, despite WHO's advice on prevention of Lassa Fever, which it says relies on promoting good community hygiene to discourage rodents from entering homes, it appears the Nigerians' attitudes towards hygiene and sanitation have not improved. At least with the fight against COVID-19, I thought I was going to see an improvement in the hygiene of Nigerians, like I mentioned last week when we talked about cholera. Now, since the beginning of this year, Nigeria has experienced a rapid increase in the number of Lassa fever cases and death reports. Hello? Yeah. Now, today on our health series, we talk Lassa fever, and we have our doctor here today to talk to us about it. He's a deputy director, the Institute of Lassa Fever Research and Control, joining us from Irua Specialist Teaching Hospital in Edo State. Dr. Joseph Okoeguale. You're going to teach me how to pronounce that name properly. Thanks for joining the show. Can you hear me?
Hello, I'm finding it difficult to hear you.
I can hear you clearly.
I'm having difficulty hearing you. I can't hear you.
But I can hear you. I can hear you clearly.
I can't hear you.
You can't hear me at all? Okay, give me a minute.
I can't hear you.
Not at all? I can hear you. I can hear you. Everyone can hear you.
Can you hear me?
Yes.
Oh, wow. But I can't hear you. I don't know why.
Neither do I.
Okay. What could be the problem?
All right. Let's see what we can do. Tunde, please help me sort that out with him while I continue over here. We're going to try to resolve what that is. All right. But I'll just keep on over here. Now, we are going to talk about this fever, which is it is quite endemic in Nigeria. Let's look at a few of the numbers. And the cases are higher during the dry season, especially.
I can hear you too.
Can you hear me now?
I'm trying to join with another system and see with my phone to see if I can hear you.
Okay, please try that and let's know how it works, as we can hear you very clearly. Now, due to COVID-19, you've been taught to wash your hands often, to keep your environment clean. Okay, so you have to mute the other one. If you can hear me. Yes, you have to mute one. Are you able to hear me now? Okay, now my screen is frozen.
I can hear you from my phone device. Thank you very much.
All right, fantastic. Thank you for joining the show. Now let's get started because I know you need to jog off in a while. We're talking Lassa fever today. This is Dr. Joseph Okoeguale joining us from the Lassa Fever Research and Control Irua Specialist Teaching Hospital in Edo State. Now, Irua is Center of Excellence for Diagnosis, Research and Management of Lassa fever in Nigeria. All right. Welcome to the show one more time. Now let's talk Lassa fever. Let's assume that our listener know nothing about Lassa fever. So talk to us about what Lassa fever is.
Lassa fever is a disease caused by a virus. The virus is called the Lassa virus. It was first reported in Nigeria in 1969, and it has remained with us. It's a disease that was discovered in this country and it's been here for a while. It affects all cadre of persons. It affects children, it affects adults, it affects pregnant and non-pregnant adults, and even neonates. And Lassa fever has contributed significantly to overall cause of deaths in Nigeria. In fact, 1% of the deaths in Nigeria can be attributed to the Lassa fever disease. Before now, the disease comes as, yearly outbreak. You just see an epidemic of Lassa fever, and of course it's reported and, actions are taken. But in the last 1 to 2 years, it has present all year round. There's no month that a case of Lassa fever is not reported. So we have been having increasing incidence of Lassa fever disease affecting all cadre of persons. Even those surviving Lassa fever, there are potentials of developing morbidities such as complications after recovering from the disease. So it has remained a public health threat, particularly in many communities in Nigeria where the disease has remained endemic.
Now we're going to talk about this. Yeah, we're going to talk about these areas. The NCDC epidemiological report for this year alone, the numbers are staggering. 11 states recorded most of the incidences that we've had this year. We have Edo State, Bauchi, Ondo State accounting for a total of 74% of all the total cases. Now, the age group, which the NCDC does a breakdown on, is that the age group mostly affected between 21 and 40 years old. Right. And that's an median age of 30 years. Also, this year alone, we've had 510 confirmed cases of Lassa fever. There have been 102 deaths from Lassa fever. If this is not worrisome, I don't know what else is.
It's quite worrisome. I would say that we started having.
Can you mute one of the devices? Can you mute one and use just one for speaking?
Device.
Okay.
I've muted the other device.
Yeah, this is better.
I don't know why Okay, let me switch off the other device. All right. I think since 20.
Okay, now this one is hanging up. Okay, let's hope that we're able to. That device
since
is hanging
2018.
up. Yes, please go ahead.
Can you hear me?
I can hear you now. Yes.
Yes. Since 2018, we have, seen an increase in number of cases. 2018, 2019, 2020, we had the highest number of cases as well as fatalities, relating to Lassa fever disease. So the upsurge actually started in the year 2018. So we started recording very high yearly cases of Lassa disease. And of course, we started a bit of with a bit of high cases this year. My center, the isolation ward in my facility is already getting filled up.
Whoa.
We barely have spaces to admit patients who are presenting to us with Lassa fever, some presenting with mild, and some with very severe cases. Our high dependency unit is getting filled up.
Whoa.
Male, females, pregnant women. And in all this, we are beginning to have patients who are having co-infection, having both COVID and Lassa fever together.
Oh, goodness.
With some devastating consequences. We had a woman who had a late third trimester pregnancy loss yesterday, had COVID and Lassa.
Oh, dear.
She's been for about 2 weeks now. She's been there. She actually got better, but she still had a miscarriage yesterday. So it has remained with us, causing all sorts of problems. The complications are there. And we think we'll continue to do our best to see if we can, actively care for some of these cases we are seeing.
Now, let's talk about the symptoms of Lassa fever for those who might not know what it looks like and the cause of this disease. Is it airborne? Tell us all the details, the health details about the cause, the transmission, and the possible treatments for Lassa fever.
Lassa fever is a viral disease, like I mentioned before. Now, at the early stage of the disease, the commonest symptom that many people will present with is fever. Fever is one of the earliest symptoms that many people
I guess that's a network. The buffer is coming from the network there. Now,
Person may have. Then
yes.
after that, about 4 to 8 to 10 days, you see the patient coming down with headache, coming down with malaria, coming down with weakness and all that. Then sore throat begins to set in. Subsequently, after this series of problems, the patient start having complications. Complications of generalized swelling, edema, renal shutdown. It's a multi-systemic disease that could affect all the organs in the body. And these are the issues. Once these organs are affected, particularly renal complications, when the patient develops some of these complications and they are not attended to promptly, it may lead to death of that patient. And of course, it could also lead to bleeding. That's why it's called viral hemorrhagic fever. It can lead to bleeding disorders. This start bleeding from all orifices. And of course, the person dies. That's one of the outcomes of Lassa fever. So it's a devastating disease. That's why we usually tell people when you have a febrile illness, you're having fever, you have fever that is not responding to common anti-malaria, you've gone to the chemist, you've taken your antibiotics, and it's not working, you feel it's not working for you, the best thing is to report to the hospital for appropriate tests. You can't keep running from one center to another to keep doing typhoid tests. Typhoid is not as common as many people think. Most of the people who think they have typhoid may have other viral illness. We have so many emerging viral diseases. Apart from Lassa fever, apart from COVID-19, we have other viral diseases like Marburg, Ebola, and some other diseases which are even yet to be reported. So it's important that when we have these symptoms that are not specific, that we are not so sure, we present to the hospital for an expert evaluation.
I'm glad you've spoken to
diagnosis and care.
Because the symptoms look very similar to what you have when you have malaria. I'm glad you've addressed those who say, oh, I treated malaria once and second time, oh, it must be typhoid. I mean, you spoke specifically to that by saying typhoid might not be as common in Nigeria as we think. So before you start drugging yourself up with antibiotics and self-medicating, please go onto the hospital to have a proper test done, a proper diagnosis also done. Now, Lassa fever is endemic not just in Nigeria, but also in Benin, in Ghana, in Guinea, in Liberia, in Mali, in Sierra Leone, and many other West African countries. But it's a zoonotic disease, and 80% of those who even have the Lassa virus are asymptomatic. The other 20%, according to the report we've had here from the WHO, have the other, symptoms that you have described. You mentioned in the beginning something very important that I'd like you to, harp on some more. That those after treatment, those who have had a Lassa fever might still come down with some other complications. Please tell me about this.
All right, let me go back a bit. We talked about it's a zoonotic disease caused by rats. Lassa fever is commoner among people who live in in rural environments, particularly places that are infested with rats, people who have broken ceiling, who have rats excrescences around their area, who don't cover their grains or eat from grains that are dried along roadside. You find people around such associated with such activities coming down easily with Lassa fever. Apart from that, it also has seasonal variations. Human-to-human contact has also been reported, particularly those who are exposed to people who probably died from febrile illness, those who work in a hospital, where they manage febrile patients, people who have fever and all that, although have been exposed to body fluid of some patients within the hospital. Those are important factors for Lassa fever. But apart from these, patients with Lassa fever could have a full recovery, have the disease, you provide the needed supportive care, give the definitive care, and of course they recover fully. However, a couple of them, for instance, 30% of patients who have had Lassa fever, have a bit of hearing loss.
Oh. Okay. Okay, the network now has taken that off for a bit. All right. I mean, I think the best thing is just to avoid coming down with the Lassa fever. Doctor, are you back? Can you hear me, Dr. Joseph? Can you hear me? Okay, apparently the network has frozen up there. But he has some really highlighted, the complications that come with Lassa fever. And what the numbers are telling us, it's another, disease that is very worrisome in Nigeria. And the numbers that we got from NCDC for this year alone, the number of infections that people are having, you might say, oh, yeah, the numbers for cholera came higher for the north, but the numbers for Lassa fever come higher down south because of the rats, and they thrive in areas where you have forests, bushes, gutters. And you think Lagos, you think rats, you think dirty gutters, you think big, scary-looking rats, and the smaller ones that are currently in your houses. Yeah, Dr. Joseph, can you hear me? I don't think that he can. Please let me know when you can hear me, if you're back here, so we can take some more questions from you. I'm going to open the phone lines right now. Some of you have gotten really comfortable with rats in your houses. You're not even worried. You're not concerned. And also, once you have malaria, like... Oh, what was that? Frozen up really badly. Can you hear me? Oh no. Oh, no. No, it's really bad. No, it's really bad. It's really frozen up. If you can hear me, you can, jump out and come back in just to... Oh, goodness. And it really needs to leave at 8:30 for a meeting. Oh, no. This is not working. All right, let me take one or two calls before my break. 0700 993 993 993. Female callers 014657 190. 0700 993 993. Good morning.
Madam Wemimo.
Yes, good morning to you. Welcome.
Good morning to you. How was your night?
Fantastic. Thank you. Go ahead. What's your name?
I'm so much happy to have your voice this morning.
Thank you.
When I heard your voice, I feel happy. My name is Azubike. I'm calling from Shode.
Thank you for calling.
Coming to this Lassa fever that we are talking about rat poison and other things. Like I myself now, I don't not see rats anymore. In my room and in my kitchen, I keep it neat. And also I have a rat gun that whichever rat that comes to in my room, they never go through. Then coming to this NCDC, they are not focusing in other diseases that is killing people. What they are actually focusing is COVID-19. We have other diseases that is more dangerous than COVID-19. I want them to lift up their expectations by fighting other diseases, not focusing on this COVID-19.
Alone. I hear you. Thank you very much. That's why we're highlighting the other diseases that are around right now. Good morning. Hello.
Call the doctor with a phone so that we can hear him.
He needs to go shortly. That's why that might not be an option. He needs to go very soon, and I need to go on a break. So that's it. I'm sorry about that for those of you
All
who
right,
are...
I can hear you now. I can hear you.
Fantastic. I'm glad to hear that. I know you have a meeting coming up soon, but I need to go on a break soon too. So I'm hoping, I don't know how we're going to work that out. But quickly before you go, what are the preventive measures? How do we prevent ourselves from getting this fever in very few seconds?
All right. We understand like the veritable strategy widespread vaccination is through widespread vaccination. You understand this disease has been here with us since 1969. And efforts to produce vaccines have just been the preliminary stage. COVID was only reported in December 2019. And you see how much effort, because it's an international disease. These are some of the politics that comes with some of these infectious diseases. I think effort should be channeled towards developing vaccine. We don't have any business with a disease that have lasted over 50 years in this country. Why can't we kick it out?
That's a big question. I share that concern with you. Why don't we have a vaccine for Lassa fever?
also do, like ensuring that, why don't we have a vaccine for Lassa? They have started
Oh dear.
some trials. We are still just at the
Okay, so here's what we're gonna do. I know that Dr. Joseph has a meeting.
good environmental.
No, this is not working. So I need to go on a break right now. But when I come back, I'll speak with him and see if I can get him on the phone for at least 5 minutes before he heads into his meeting to talk to us about preventing measures. And he had a good point going on there about vaccination for Lassa fever. There is vaccine for cholera that we talked about last week, but the vaccine is not readily available. It's not something you walk into the hospital to just go get unless your community is endemic. Are we deliberately risking the lives of Nigerians? That's my biggest worry here. COVID-19 is good to tackle COVID-19, but we have these other diseases that have been here for too long to be killing Nigerians at this very high worrisome rate. So I'll go on a quick break. I'll speak to Dr. Joseph and see if I can get him back here before we go back. He goes into his meeting in a few minutes. This is 99.3 Nigeria Info. It's Health Thursday. We're talking Lassa fever. Stay glued to your radio set because I will be right back. Don't go away.
Are you looking to expand your business to put out?
Call 0700 Ilera Eko or 0800 Ask Lashma or visit
Gosh, we spent the whole of the break trying to fix this so that we can hear you. I know you have a meeting coming up shortly, but I really need to hear you speaking about preventive measures, for Lassa fever. So you can go on now.
All right. Like I mentioned earlier,
yes,
you see, vaccine still remains the veritable strategy that will have a wide coverage, of preventing disease. But outside the vaccine, which is not available to us now, there are a few things we should be seen doing or that we can readily do. The first is to ensure that we maintain a good environmental hygiene.
Yes.
Clean all the places around us, remove dirt, identify all areas that are covered by rat excrescence and clean them up. If we have broken ceiling and broken areas in our homes, we should fix them up. And then the kind of the ways we preserve our food within our homes is also very important, particularly grains. We should begin to get fitted containers that could contain our grains that we consume every time. It's very important. And also, we should also try as much as possible to discourage bush burning, because when sometimes when they burn bushes during the dry season, you see some of these rats leaving the bushes and coming into homes. Oftentimes we have an increasing outbreak when this happens. Then outside this, early identification of the disease. If you notice anybody that is having fever, that is unresponsive to common anti-malaria antibiotics, this person should report to the hospital immediately. Typhoid and malaria are not the cause of every fever that we have.
Yes.
And we've seen over time that early presentation is associated with good outcomes. So when they come into the hospital very early, we are able to deal with some of these situations, identify them early, manage them without complications. So that early presentation is very, very key for us. And of course, training of more healthcare workers on how to identify Lassa fever and then treat. If we increase the number of diagnostic centers in Nigeria, probably we'll be able to pick more cases. There are not so many right now in the country. But if we have rapid diagnostic tests that can be deployed to many institutions, it will also help so that centers that don't have those PCR machines that are required, to make diagnosis of Lassa fever can do simple rapid diagnostic tests at bedside. Patient is presenting with fever, you do an RODT, just a bedside kind of test that will say whether the person has this Lassa or not. What was done over the past few months, in which the government commenced the process of deratization. They went to the bushes and killed as much of the rats as they can kill. This was very helpful, particularly I think last year we had, fewer number. They were not as much as what we had in 2018 and in 2019. That deratization exercise actually helped. If it's unnecessary, the government can repeat over time. It's going to help to a very large extent in, reducing the number we record at every epidemic yearly.
Because you're from the Lassa Fever Research and Control Center, right? This is why I'm directing this question to you. Talking about the vaccine, I want to stay on that for a bit. If we've had a disease with us since 1969,
yes.
What research are you guys carrying out? I mean, how come we don't have a vaccine? I mean, aren't you carrying out research?
Yes, of course. There are various consortium, not just local efforts. They are both local and international efforts to generate enough evidence that will inform the production of vaccines. There are a lot of local efforts through researches that are currently carried out in my facility, Raspberry Teaching Hospital, and my CMD is Professor Okoeguale is very serious about the researches because he has interest, particularly in vaccines for all emerging viral diseases, because he has seen the consequence of some of these diseases within our facility. So there has been this effort both locally, and then there's this West African research group that are currently working on, trying to carry out more researches to ensure that these vaccines is available to us in the shortest possible time.
So why I don't know what short time can be shorter or longer than whatever we've been doing since 1969. What exactly is the challenge?
The problem is the international recognition has not been there, like what you had with COVID-19.
Oh, so we're waiting for international organizations to produce vaccines for us?
Not necessarily. And I think our government has not paid so much attention, as would have been expected to have been paid to it.
So can we actually produce vaccines for Lassa fever and possibly for other diseases in Nigeria? Do we have the capacity to do so?
Yes, we can. We have the capacity to produce a lot of vaccines, not just for Lassa fever, for a couple of emerging viruses. There are centers that can be harnessed, to produce some of these vaccines. But you see, it will require a lot of efforts, both from local efforts and particularly efforts from the government, efforts from the federal government. They should invest more on researches and vaccine production. It should be a major part of the budget of a country like ours, because this disease continues to remain with us, causing varying forms of mortality and short and long-term consequences. Who are the people dying from the disease? There are still people living within Africa, particularly West Africa. We can't continue to wait for partners, for our neighbors to produce some of these things that affect us. We have the strength, we have the money, we have everything. Just the political will is not there, to invest in some of these things and ensure that these vaccines are produced and actions are taken, and the vaccines are produced locally within not just in Nigeria and even in other West African countries.
Yeah. I hear you. One more before I open the phone lines, if you're still able to stay with us before you go, is the issues around the deratization, like you mentioned. Lagos State is very endemic. I mean, I know many other states in Southwest, especially South, are also very endemic and have a lot of rats. But, I mean, there's also should be a synergy between the Ministries of Agriculture and Health in this regard, because the food that we're talking about are food produced along the villages, the road path, the gari. Those are the foods that you don't get to cook before you eat. You buy the gari and it's straight into water and straight into your mouth. Or if you're making the eba, then you cook it on fire. So if I make eba on fire, for instance, and the gari is already infected with rat substances, is cooking it on fire going to kill the virus, number one? And then in your work over the years, do you see a synergy between the Ministry of Health and that of Agriculture to ensure that we don't pass on infections from the food our farmers grow?
Yeah. First, I want to say that the viruses are very weak viruses. If ultraviolet light at the temperature of 55 degrees Celsius can kill the viruses.
Cool.
They are weak viruses. So when you expose the gari very well to very hot sun, they can even be killed. But the problem is in trying to expose the gari, you can see rat coming from the bush with defecating on the gari, excrement and all that. So that's the problem.
But you know that this gari that's sunned, if I'm correct about the process for making gari, after sunning the cassava, then they fry it on fire. Shouldn't that
even
frying?
After frying, people still go back to sun them.
Oh,
you get what I mean?
Okay,
that is the issue. Otherwise, when you fry it, that's why sometimes when they buy the gari, they find a way to still come back home and fry it. There was a time we started recommending such home practices for people who consume gari in large quantity.
Okay, to fry the gari at home before they start drinking.
Yes, before they start drinking.
Okay.
Or for those who are going to use it for other, who have to heat it to and other things, they may not have to start doing that and all that again.
Okay.
So it's part of those measures.
Okay.
Then outside this, the other problem Nigeria has had over time is this lack of coordinated responses, between various ministries, particularly for epidemics like this. I remember the last time when we had deratization, there were this effort from Federal Ministry of Agriculture and all that, forestry and the NCDC,
Environment, and the Ministry of Environment also.
Yes, to come together to ensure that that project was successful. And it worked. It actually worked. So if we can have these coordinated responses, you see that it will go a long way in curbing most of these rodent disease caused by rodents. So not just Lassa fever, many other diseases.
Many other zoonotic diseases.
Rodent-related.
Absolutely.
Yes.
Let me take a few calls. Do you have to go now, or do you have a few minutes to spend with us?
I just have maybe 1 to 2 minutes to go.
Okay, so let me take one call in case I have a question for you before you go. Good morning, hello.
Hello, good morning.
Yes, welcome to the show. What's your name?
Thank you. Good morning, the doctor. I have a question. Now, if you look at the symptoms of all these fevers,
yes,
you see that they are somehow very related. And in this part of the world, once you have headache, the next thing is this medication of taking paracetamol and the like. Are you getting it now? So what can we do to stop all this? What can we do?
All right, thank you very much. I'm going to take one more. Good morning, hello. Oh, you are gone. All right, do you want to answer that question before I take another one?
All right. What we need to do is to have a high index of suspicion, particularly this season. When you hear that there's a Lassa fever outbreak, you have to be very cautious.
Yeah.
You know, you must know that not all fever then are actually caused by malaria. Not all fever are actually caused by virus. Now, when you have fever and you are feeling extremely weak, this fatigue, very kind of fatigue. For those who have had COVID before, they will understand what I mean better. And then subsequently, the person starts having, having headache, start having malaria, and over time you notice, there's bleeding anywhere, or you're having swollen body, swollen neck, sore throat. You should begin to think that this one is no longer normal.
But if I walk into a hospital, the same way they can carry out a malaria test, can the doctors also quickly think Lassa fever? I know they might think COVID now, but would they also possibly think Lassa fever?
We continue to talk to healthcare workers.
We're not there yet.
Identify some of these symptoms. It's important because many of them still can't identify some of these symptoms early. It's important that when you've treated malaria, you've taken a complete course of anti-malaria. Some have even taken a complete course of antibiotics. They still keep having this malaria, the fever is not going and all that. You can't continue to treat fever. We notice that some of these patients are still admitted back into the hospital.
Yes.
And they just continue to give them antibiotics and anti-malaria. That's what happens in some peripheral private hospitals. So it can be very difficult. We are beginning to talk to people themselves and patients themselves. When you see yourself in such situation, you can move to another hospital. You don't have to wait to give you all the flus in this world, give you all the antibiotics in this world. You are developing complications. You are not getting better. You are having reduced urinary output. You can't pass urine again. And you still continue to remain in the hospital and nothing is being done. You should begin to think of how to save yourself.
But at this test, the Lassa fever test, is it readily available? I mean, at laboratories, and the hospitals usually have labs. Is this something they can do very quickly?
We have several reference labs in the country. We have over 80 reference labs in the country. And I know that every state is every region of the country is supposed to have the capacity to perform a real-time polymerase chain reaction and detect Lassa fever. But it's not available to all hospitals.
Okay.
That's the only drawback.
Okay.
But in many areas, like in Lagos, there are reference labs. You have in Lut, in Lasut, and even private labs that could perform Lassa fever tests. And in many other areas, not just in Lagos.
Okay.
In Abuja,
there's one
in
more. There's one more important question. So from the moment of infection, when does it become too late to treat, or from how soon does the complications begin to set in? What's the process? I mean, how many days after infection, do you begin to see symptoms, and when is it too late to treat?
Sometimes the progression may not progress typically as one would expect. But what usually happens with the disease is that the evolution of the disease is such that it starts with fever within the first 3 days.
Okay.
Fever severe weakness, severe fatigue, and all that. And then subsequently, the person begins to develop headache, develop sore throat, have diarrhea, vomiting, nausea. That's just within the next 4 to 8 days.
Okay.
When the disease has lasted over 8 to 10 days, the person may begin to have generalized body swelling, neck swelling, bone neck, and then the person starts having, when the person develops complication, kidney complications, starts having reduced urinary output, and then start having renal pain, abdominal pain, and all that. When all that begins to set in, you know that the complication is already setting, and this person probably may have taken several medications.
Yeah.
So the progression is usually typical for some people, but for some, it may not happen in that way.
Okay.
Some pregnant women will come in with a pregnancy loss, even without the fever. And when you perform a Lassa PCR, you see that they are having Lassa fever. This is a common cause of early pregnancy loss for people who have had fever and are having pregnancy losses, or an intrauterine fetal death. The baby may just die in utero from Lassa fever. It's one of the commonest complications that Lassa fever can cause in pregnancy. It causes unexplained stillbirth, unexplained miscarriage, intrauterine fetal death, even early neonatal death in some neonates in which Lassa fever were not detected. So
for mothers that have Lassa fever, if they do successfully have a baby, does a baby also have Lassa fever?
Well, if I wish I had more time, because I am an obstetrician and I manage Lassa fever pregnant patients in my facility. The presentations are varied. There are cases in which the baby becomes negative after at birth. There are some cases in which baby also becomes positive after birth. So it varies.
Okay.
We have even had cases, the mother is negative. The mother is negative at the time she is delivering, and the baby still remains positive after birth. So,
wow, this is very serious.
So
this is very serious.
When we have other discussions,
yes, definitely.
We can say more.
And I know I've totally squeezed out your time. I totally appreciate you, Dr. Joseph Okoeguale is a Deputy Director, Institute of Lassa Fever Research and Control at the IRA Specialist Teaching Hospital in Edo State. Thank you very much for joining the Morning Crossfire.
Thank you.
Nigeria, we're stuck together for the next few minutes before I go. Let me see. I've got 1 minute or two. If you want to call, is 0700 993 993 993. Oluwaseun Olatunde is watching on YouTube and says, because of surge in all these diseases, the first call should be to go to the hospital and do proper tests. We like self-medication too much in Nigeria. I can't say that enough. Good morning, hello.
Hello, good morning.
Put off your radio quickly, please.
Sorry.
Please, come on now.
I actually have a complaint.
Very quickly.
Yeah, there was this time that I got bitten by a rat.
Okay.
Yeah, and to that extent, there was blood on my finger. So
okay.
I don't know how you can give.
Oh, did you go to the hospital?
I didn't go to hospital.
So now that you're calling me, do you want me to run a lab test for you over the phone? Come on, go to the hospital and run a test, Jerry. And you are still calling me. Go to the lab and run a test. Can you imagine this human? Let me see. Okay, I think I can do 1 more minute. Okay, let me pause this out. Good morning, hello. Final, very quick. Hello.
Action lady.
Yes, sir.
Let him go to the hospital. He wants you to run tests.
Also, Mio, I don't know. I don't.
Action lady. Nothing to you, my sister.
Thank you very much. Good morning, final one. Hello.
Hello, good morning.
Good morning.
My name is Ayo. I'm calling from Hygiene.
All right, please make it quick. My time's totally up.
Yes, I wish the doctor is still online. You asked a question. You said since 1959, and we cannot produce the vaccine.
Also, Mio, sincerely.
Are we waiting for international organization?
But
the question, I think you would have gone a bit more. Is, have we ever produced vaccine in Nigeria?
Anyone at all?
Produce anyone. If I thought there is one, because he said it's not like that. If it is not as that, then why have we not produced one? If we have produced, how did we? Mention them, because Nigeria, the way I know, I don't think we can produce vaccines.
We have the capacity, but we just don't have the will. But I need to go right now. My time's totally up. Thank you all for being a part of the show. I hope you learned one or two. I'm back tomorrow morning at 5 a.m. on the Morning Crossfire. I'm on social media at Wemimo Sports. Let's keep talking. Have a fabulous day. Jimmy to join you here by 9 o'clock.
The Supreme Court basically said the only type of register the law recognizes is paper-based.
News.
The Senate has condemned the proposed siting of 20 projects in Lao local government area.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.